I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Hello, and welcome to this episode of IDD Health Matters. Our guest today is Mary Brogan. Welcome, Mary.
Thank you.
So, Mary, I know that you are the State Director for Developmental Disability Services in Hawaii, right?
Yes.
Tell us a little bit about what you do in the field.
So I'm the administrator for the Developmental Disabilities Division, and our biggest task that we do is to oversee the 1915C waiver, Medicaid waiver for people with intellectual developmental disabilities. We have an organization that also does case management by state workers internally. We also have a few other business lines, I guess you would say. We oversee the state neurotrauma special fund, neurotrauma system, and we have a dental program, which is really nice. We have dental clinics.
Now, that's fantastic because we know that dental health needs are sometimes even more challenging to meet than medical health needs.
Yeah. So we have a contract for operatory services at the hospital, the major hospital in Honolulu, Queens, and we run like safety net clinics. The children's benefit for dental services has always been in place under EPSDT, but the adult benefit just got restored in this last year.
That's wonderful because we know that there still are a number of states that don't have adult benefits for people on Medicaid, right?
Yes. Yeah. And we serve a lot of adults that probably would not get services in the community even now because a lot of dentists either don't take Medicaid,
right,
or they don't see our people as being attractive patients.
I understand that. That's one of the challenges, I talk about regularly on the program is the real need to cultivate a better understanding of how to provide health care and dental care for people with intellectual and developmental disabilities among health professionals. Yes. And to see them as people first, for all of us to see them as people first.
I think that's going to be the next frontier for us, is really engaging with pediatrics, internal medicine, psychiatry, because they don't normally get that training.
Well, Mary, that's great to hear. Let me help you with that if I can. That's my passion. That is, because I had to learn things the hard way. I started in this field in the late 90s and began working at a large ICF at the time and realized how quick or how little I knew about providing healthcare to people with disabilities. I spent the next several years learning a tremendous amount from people with disabilities, from the support staff, from DSPs, from the nurses that had been working there for a long time. And when we started moving to more community-based supports, my biggest concern was that people with IDD are not going to get the healthcare that they need, because I knew that most clinicians in community settings had the same level of training which I did, which was zero. So now that's my primary focus, is to provide training and education to healthcare providers everywhere.
Yeah.
So
delivery systems have changed so much, and I think that when we went to just community-based services, people in our state get their healthcare services through the 1115 Medicaid plan, and people still have the mindset that this is the agency that had the institution. They provide everything for these people. They provide, the vocational, the dentistry, the health care, but it's not true. Their access is through the health plans just like anybody else, but they don't normally get access. And a lot of times, they have conditions where they don't articulate what's going on with them, but it is indeed a physical health issue.
Yeah, that's well said. That's one of the, actually my favorite things to talk about are behavioral, manifestations that indicate some sort of underlying medical condition. Because so many times when we're unaware, when we're not trained, we see a person who's having aggressive behavior and we might think, oh, well, maybe they're having a mental health condition, or this is just what they do because they have a disability. Right. And we call it diagnostic overshadowing, where we attribute everything to the disability rather than looking for an underlying cause.
Well, and we don't have access to enough healthcare practitioners where we can bring that kind of transdisciplinary view into the conversation. And what happens is people suffer for years as a result of, having arthritis or toothaches or, anything.
Well, you're speaking my language, Mary. I'm totally with you on all of that for sure.
But then how do we build the practice models at in our DD agencies that can accommodate that systematically and not just wait until somebody goes into crisis?
That's right. Preventative rather than reactive.
Systematic.
Yeah. I love that. Okay. Excellent. I'm glad. I can't wait to see what you do on that and how it evolves. So, Mary, I know that you have a role here with the NASTIES organization, which is, for everybody out there, one of the alphabet soup things. National Association of State Directors of Developmental Disability Services. And we are coming to you from the NASTIES conference in Portland, Oregon today. And Mary, tell us about your role with the organization and a little bit about the organization.
Sure. So NASTIES is a great organization. I'm on the board of directors. I'm now president of the board of directors.
Congratulations.
Thank you. I've been on the board for a while. I don't even count how many years, but they're our representative organization, both on the federal-facing work. So they're our eyes, ears, voice at the federal level, and they spend a lot of time doing federal policy work and building the bridges at the federal level with a bunch of different sectors and agencies. And then they're also really have become the thought leaders and really the how do you develop practice and how do we develop our ways of thinking and move the needle forward for people with disabilities and really represent them the way that they should be. So they do a lot of technical assistance with states because we are really healthcare delivery, but we don't have the persona or the infrastructure or the skills often to do quality management, to do manage grievances, to be able to look at data and predict trends and analytics or, all those things that you might see in a normal health plan or hospital. We're kind of building it as we go. And so they help us a lot with kind of that business acumen and management of networks, especially for small states like mine, who have still one foot in the institution in terms of even the staff that work for us. We have to really retool and use these opportunities to really transform and reinvent ourselves. And so that's kind of what stage we're in, is that growing up.
Yeah, I understand. One of the things that I think is great about this conference is that the state directors really come together and talk about what works and what doesn't work and what different people are doing and really sharing a lot of those ideas. Are there some other things that you really like about the conference itself?
I think that looking at the role of the state DD director and the importance of really having a good relationship with the state Medicaid agencies. And structurally, we're all different. Some DD agencies are in the same agency. We're in Department of Health. We're different. So we really have to build those partnerships. But I think that it's just amazing the amount of knowledge and passion that the directors have for this work. And it often feels very lonely out there, but we're fighting the same kind of battles with our state legislators and the public and the providers. And I think there's also been a real synergy around a shift from kind of we own the services. There's a power differential between government and the people to be, we work for people.
Yeah.
And so has been a really nice shift for me to see that engagement, bringing individuals, self-advocates to the table. And I think that we're just watching this enormous change in the field, and that's really nice to see.
Yeah, I agree. When I know a couple of things that you said, just to touch on those, I spent most of my clinical career working for the state of Mississippi, and you learn how that state works and how you do things. And then as I began working on a broader level, I realized you learn how one state does things, and you pretty much learn how one state does things, exactly, because right. Each state has its own way of doing things, its own structure, and they're all a little bit different. Mm-hmm. All really working towards the same goals, but they're all a little bit different, and so they all have their own nuances and little things you have to always keep in mind and look at.
And our job didn't come with a manual, so
that's for sure.
No training program.
That's for sure. What are some of the advances that you've seen in this field over the last several years? The positive things. Let me couch that just a little bit. I know this, working in the state, sometimes a state agency gets blamed for so many bad things, or it's always looking at the negative things, or always the things that didn't happen, or the things that didn't go well. But there are a lot of things that really do go well, and that state agencies do quite well. So that's what I want to touch on. What are some positive things that you see happening? Mostly
from the Hawaii perspective, mm-hmm. which is our partnerships have really grown, and they were a little rocky at first, because I think historically there hasn't been that kind of systematic planning together, and there was a bit of a blame culture, both within the organization and with other organizations. Families weren't seen as partners, but as, these people that you have to withhold resources from. So seeing that shift to be, and our organization thought they were very person-centered. It's like, oh, we got that, final rule, we got that part of it already. But it was so far away from being person-centered, and I think that was a big aha to everybody, that there's a different way to have a relationship with the community.
I like what you said about person-centeredness in terms of, many people do think that they're person-centered in their way of doing things, but until you actually get a little more into it, you realize, okay, wait, there are better ways to do this that are actually much more person-centered, and figuring out how to support that person to have the life that they want, as well as not just what we think is best for them. Mm-hmm. Yeah, and then it's a transition that has to occur.
And then we find, working with the other agencies that touch people's lives, like there's a lot of people in Hawaii that have Office of Public Guardian involved guardianship, many of them. And that mindset, and maybe it's the language that is built into their regulations or their statutes, is, they'll use words like not competent to make decisions. And here we've moved past it. So what we have to do is engage a lot with the other agencies. I think during the pandemic, that was such an opportunity to create really different kinds of relationships. And as a result, myself and, for example, the state Medicaid agency, the clinical director, the medical director there, were systematically doing things together all the time. We meet like every other Tuesday and just plan things together. And now we're going to bring in child welfare much more. We, the partnerships, even on a case-by-case basis, have really changed from, oh, that's your job to, do that, to how can we help? And there's so many myths that go around about why we can't do things. And we found out that, maybe you can. people.
Yeah, maybe you can. And it takes sometimes a person to nudge that along and move that forward and be a leader. Mm-hmm. Yeah. So, Mary, let's talk about Mary for a second. How did you get involved in this field?
So quite a few years ago during the 90s, I worked in the governor's office in the state of Hawaii in the children and family policy area. And along came a class action lawsuit that we got involved with. And it meant sweeping changes. People thought that it would be just building wheelchair ramps or something. It was with children's mental health and enjoined education. And based on IDEA law and 504, which it really meant transformational change. And I got involved from the measurement and monitoring perspective. And then when that lawsuit was kind of moving into being more integrated into the departments, I moved to the children's mental health system and did a lot of complex system change there. And also had the opportunity to consult with other states, Arizona, Washington, D.C., Massachusetts, Indiana, various other states around these system changes and methodologies for looking at practice and measuring change. And in children's mental health, there was a big autism population, many people with co-occurring ID and mental health issues. And at that time, the DD agency served very few children. And so eventually I moved into another policy arena, and I was recruited into this position because I had experience in really heralding how do you transform systems, how do you change systems. And I didn't know what I didn't know, so I just, kind of went with it.
And none of us know what we don't know, and the best thing is to learn. I guess to keep on learning,
and
keep on growing.
Water your garden and really build your staff, and
that is
an amazing team.
That's actually pretty neat that you said watering your garden, because that's the way I see being a leader. Really, is not telling everybody what they need to do. It's putting people in places where they need to be, like little seeds in the right area, and then giving them what they need to grow and flourish and foster. And then, so watering your garden.
And if they don't grow, then,
sometimes you have to.
Make decisions.
Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support.
So, Mary, one of the things that I do on the show is something called 3 in 3. So it's 3 things in 3 minutes, and I'm not going to hold you to 3 minutes. But 3 tips, 3 words of wisdom, 3 pieces of advice that you would want our listeners to know that you think could improve support services, health, wellness, whatever, for people with intellectual and developmental disabilities?
I think as a state administrator, I had to really learn a lot about the budget and following the money and making sure nothing was left on the table. So if you're not taking advantage of administrative claiming, there's just so many opportunities that people kind of turned a blind eye to because it was hard to set up the mechanisms to make them happen. But
I can relate to that a little bit, and the budgets are no easy thing to understand sometimes, and how it all works and figuring it all out. So that is a challenge. So yeah, getting a really good grasp on that and understanding that,
and understanding the lines to the federal funding, because CMS was enormously helpful to us in building our IT system, case management system.
Nice.
And we were able to, realize 90/10 funding. It's just been an amazing process over the last 5 years to modernize our IT system or install one, because ours didn't work really. The second thing I would say is partnerships with self-advocates, number one.
That's something we're seeing a lot more of. That's very positive in the field as well. Is
they're teaching us.
Yes, and helping us understand what they need.
They're our customers, and they tell us what they need. And a lot of what we were giving them, they don't need. They don't want it. So it's just really being able to listen and create relationships there. And then the others with providers. We had kind of a contentious relationship with providers for a while, but something happened during the pandemic, and
people came together at a time of great challenge.
And different leaders emerged, and there was a lot of goodwill, and it was just, for us, just at the right time. So those are probably the two things, is the partnerships, and the other is go home on time.
I like that. How successful are you at going home on time?
No, I'm pretty successful. After my husband retired, a lot more successful. But
good. That's good to hear.
But for a long time, I worked really hard, and I think that you have to balance, or you're not good to anybody. So.
Yeah, you've got to take care of yourself first before you can take care of other people.
My secretary said, put the air mask, the oxygen mask on yourself before you put it on somebody else.
That's true. In medicine, we say check your own pulse sometimes before you check the patient's pulse. You have to be calm and in control of a challenging situation. Right. Yeah. Those are great things to ponder for everyone. Mary, thank you so much for taking the time to join me today and tell us about the great work that you're doing. More importantly, thank you for the incredible work that you've done in this field.
Thank you.